Hi everyone. My name is Bhishan KC. I am a project officer at Medic Nepal. Now, can you please move next slide? Uh, Thanks. Now I will be presenting the current GPS data capture scenario of Nepal. As we know, CHT automatically captures GPS coordinates in the backend through the all submitted reports. Now we are able to capture 22% GPS data of the total submitted reports. But this is a relatively low capture because during the during the early implementation phase, this was not prioritized, and also partners had not requested to capture the GPS coordinate. So CSWs had not granted to GPS permission to the CHT apps. Uh, Once partners had requested to capture GPS coordinates, we provided training to the CSWs on granting GPS permission to the CHT app. As results, we saw more improvements on GPS data capture. In our most recent completed deployment, we are able to capture more than 80% GPS coordinates. Now, currently, GPS data is visualized in analytic dashboard in different platform. We are provided its access to community health officers and their supervisors to monitor the CSWs and their reports submitted from their check and cross-verify their submitted reports from the beneficiary's home or submitted from their somewhere else. So this is helping to improve data quality and supporting better supervision. Can you please move next slide? Uh, Now I will share the current GPS gaps we have identified. I already mentioned that CHT automatically captures in the backend. So CHWs are not able to see the GPS data capture status. And also they don't have access to location edit option and correction. So also they are not able to retry if GPS record was failed, and also CHWs are not able to capture GPS data through the contact registration or contact form. Please move to next slide. We are working on improvements to address these gaps. CSWs are can able to capture GPS coordinates through contact registration or household registrations, and also they are able to see the GPS data capture status. GPS record GPS data capture is successfully or not, and also they are able to edit the GPS location if previously recorded in other locations. And also CHWs can able to retry the GPS location if recorded fail. CHWs can slightly adjust their location and they are try to recapture the GPS location if found record fail. And if they can try to multiple times, if GPS signals are weak, they will click without GPS location and submit the forms. That is all from my side. Thank you for your time and attention. If you have any question, happy to answer.
Thanks, Bhishan. First question, you mentioned that the current capture status is 80%, but going back to one of the slides, and we can go back to that, Sugat, I saw as if the captures, like the Sugat, you can go back. Yeah, I can see like it's almost 22%. What does 22% mean? The next slide, Sugars.
Yeah,
Yeah.
thanks, Anthony, for the question. I already mentioned this is 22%. This is only for 5 municipalities. And I already mentioned during the implementation phase, and we collected lots of information. So during that time, missing the GPS coordinates. So I mentioned more than 80% uh, that was only one municipalities which was recently completed because we provided training to the CHWs. So we are able to capture more than 80% in only one municipalities.
All right. Thanks. Sugat, we can move on to the next slide. And as we do that, we'll one back. I will call upon Clifton to take us through this section.
Great. Thank you, Anthony. Can everyone see the screen with the CHT running in it?
Yes.
Okay, good. All right. Well, I will show some of the scenarios, just some of the basic scenarios. This is currently under development, but we believe it's close to being done. Thanks to Lal for the designs on this. And thanks to Deanna for the feedback so far as we've worked through it. I'm going to go through an example of recording the GPS location for a new household. We'll also, Bishan mentioned that sometimes we have trouble capturing it and they don't really know. We'll show you what that looks like to retry. Obviously, most implementations will already have households in their records, and they might want to add the location to existing households. So we'll show how that works. Or there may be cases where the previously recorded GPS location is no longer valid. Maybe the household is moved, or for some other reason, and show how that can be recaptured. So we'll start with the first scenario here. We're going to create a new household. Give them this very realistic name. Here we go. All right, so one thing Bishan mentioned was they're able to specify whether they're at the home or some other place. This is targeted at households, this implementation is. So in this case, I'm the CHW, I'm at their home, I click home, doesn't work. I've got a message telling me that the signal is weak. I should go outside. So I step outside, I try again, still doesn't work. So I don't know, I hold the phone over my head or something to make sure it works. And then we retry, fingers crossed, there it works. So we're good. And then we can finish up. And because we're often interested in the data here to sort of track where I think Bishan mentioned that we want to know if it has been completed at the household, right? So let me just show you, for those who like to see the data, this is what it will look like. There is a geolocation field on the household contact. It's also captured in the log down here. So every time there will be a new that it's recorded, there will be a new one recorded. And in this case, it's been tagged that it's at their home. And that's what the data look like for that. So let's see if we can. Oh, hold on. Okay, there, let's go back. Okay, so let's go back to take a look at a household where it's an existing household. We don't have a location captured yet for it. I'm visiting them, and I want to edit their record. Again, same if the capability has been added to the edit form, you'll see looks very familiar, same thing as before. I can select home. This time I got a good signal immediately and save, and it will be saved to their record. And then one other scenario, and that is, let's imagine that they have we don't believe the original location is valid for some reason. Maybe they've moved. When I go, well, let's start. Let me back up a second and just explain that if I want to edit the household and the location, the geolocation is added to the edit form, and they already have a household, already have a location captured, you'll see here that it lets them know that they have one captured. It defaults to keeping the existing location because that's more than likely obviously the most likely scenario. But if there are cases where they need to try a change, then they can capture a new location. We only want them to capture it if it's at their household. So there's a warning here and a request for confirmation that it's at the household. And then we have a new location. And let's check the record again and see what this looks like. Did it update yet? Okay, so we have the location. It's probably the same location, isn't it? Because I'm just standing here, but you'll see in the log that we've had 2 captured. So that's it. Any questions?
Is this functionality going to be on by default, Cliff, for all kinds of contact forms, or do we need to update our contact form configuration to enable this?
You'll need to add the widget to a contact form. This one is specific to the household, though. You'll notice the language there was very specific to a home. If we want to add it to other sorts of contact forms, we would probably look to extend it or change it in ways that allows us to make it work for other types of contact forms. But the implementations will need to add it in as a widget. It'll be a widget in the app that can be added in. It can be added in, of course, as a standalone page in the form, which you saw during the creation, or just as part of a page, which you saw during the edit. Any other questions?
There is a lot of feedback from the community. That was an awesome presentation and demo. Daniel, would you like to unmute and just share your feedback? And I had I've learned that you had indicated you had used geolocation to track healthcare worker reporting patterns. Would you like just to share more insights about that user story?
Thank you, Anthony. It's nice to see you again. Firstly, for the feature that Clifton was presenting, I was essentially just saying that as the location is changing, just keeping track of it in the location log, I think is really good for just tracing and auditing as well. So yeah, definitely love that. For about the work that we did, so I was on a project in Kenya before for community health workers, in which we're trying to see the value of maybe two-way interaction through SMSs between pregnant mothers and CHPs. So we were tagging, I think, the reports and the forms with the location of where they're being submitted from and the times as well, just to be able to sort of have some statistics of when and where these reports are being reported from as well. And also just to see if people are then reporting truthfully as well, because in some cases you might find that someone is saying, oh no, they reported the information, but you find that they are sat under a tree somewhere and then submitted everything in one go, which would then indicate that perhaps they're not doing the work correctly. So I think before, that's what we're using the geolocation tagging feature for. Yeah. Thank you.
All right, thanks. And Daniel, what were the insights you discovered from your research? Were like users submitting the reports from the households? Like what proportion of the reports were matching based on the analysis that you were able to do?
I think for the reporting patterns, you'd find that in most cases, people are indeed reporting from the locations that they are saying they're reporting from. But in some cases, like maybe 15 to 20% of the cases, you find that someone is saying that they submitted a form from a particular location, but in truth, it's entirely from some place where they just, I don't know whether it is due to a high workload or something like that. They just submitted quite a number of forms from one particular location, like some form of bulk data entry, but not one that is sanctioned, right? But that trail then enables us to be able to see what's happening. Not that in itself it's a bad thing, really, because if that is happening, then I guess it just helps us also understand how the CHPs are working, their experiences, and how we can sort of support them in their work as well. But I think seeing that and with better community engagement, the situation did certainly improve as well.
All right, thank you. And that should be CHV Neo, right?
Yes.
Okay, thank you. And we are looking forward to also reading the insights from that project. So if you have any insights or findings you could be able to share, it would be great just to post that on the forum. I can see a couple of implementers here. Let me put some on the spot. I know Adrian, CHT Kenya is one of our national projects collecting geolocation. Has the team explored on how you could be able to leverage geolocation to improve service delivery, or what are you exploring? What are you exploring on how you can be able to use geolocation?
Thanks, Anthony. So on geolocations, there's two places that we've tried to look at it. However, there's one thing that we grappled with, which was now the accuracy of that location information that was collected. And with this now demo that has been done by now Clifton, I'm pleased at the progress that we're making. So the two places we've tried to look at it is in terms of now community health worker work, and as Makanema has rightly put, how there are patterns in services. Then the second bit that we tried to implement it was on mass drug administration campaigns. I think you remember that bit, the mass drug administration campaign where we really wanted to see where the community health workers were now administering the medications from. And that would have in turn helped us look at where a few of these diseases are endemic. That's one. Then a third one has come to mind that we also worked on in Kwale and in Kilifi for neglected tropical ailments, where we were trying to find households that had people with now conditions like hydrocele and leishmaniasis and so on and so forth. So yes, it's a very good feature, and I'm happy to see its implementation and some very good insights. And I'll share this with the team at CHT Kenya and now figure out a way to implement it and see how we can benefit from this thing. Yeah. Thank you.